Today we're going to talk to a 37-year-old man who's made a decision to utilize anabolic steroids, and we're going to get his perspective on this today. Welcome, Anthony. Good to see you.
Great to see you.
Thank you so much for being here. First off, we know you're 37 years old, right?
Yep, that's correct.
Why did you start using steroids? What age, and why did you do it? And bring us up to today.
So I first started when I was 21 years old. I started because I grew up with professional wrestling, of all things, right? And I looked at those physiques as like, man, I want to be big one day. And you know, everybody growing up even say, well, they look like that because of steroids. And it was supposed to be a way to say, don't do them, like it's a bad thing. But to me, it was just a blueprint. It was oh, so that's what you got to do. You got to start working out, and then eventually you need some of that, and you look like them, right? You know, little do you find out that not everyone gets the same results. But you know, around 21, I've been training for a couple years, and I was like, okay, let's try some testosterone.
So my first steroid was
it was a
Testosterone?
Yep, Testy, 250 milligrams a week for 10 weeks. And at the time, I got in Superdrol, which was legal. You just could walk in. You could walk in. It was just sold as a bottle of Superdrol, and I took like one of those a day for like the first 4 weeks. And that was my first cycle. And
how much did you weigh? What did you get
at the time? I was like I got up to about like 185 pounds or so. You know, I was a small guy. I first started working out, I was about 140 pounds.
Wow. So you gained that much the first cycle?
Yeah. You know, first.
How long did it last?
10 weeks. But, you know, obviously, look, I just started eating everything, right? You know, it was the whole thing, eat. You know, eat big to get big was always the motto. So I ate, I did my test, and I was like, all right, I like this. And of course, like all good things, they come to an end, and you know, you do your PCT, right? I did my PCT, and I lost a lot of the weight. And then I said, oh well, I think I got to get back on.
How did it affect your sex drive and your being shut down, as we know now?
You know, at least being a 21-year-old, I don't remember it ever being much of an issue.
And after that's 12 weeks of testosterone and just some oral Superdrol.
Correct.
Right.
Yep.
So came off. How long did you come off for that first time?
You know, at the time I was told time on equals time off, right? So I took roughly 3 months, and then I was like, you know what, let's step it up a little bit more. You know, at the time the big thing was, oh, 250 milligrams is not enough. 500 milligrams was the starting dose back then. You know, the forums and, you know, the early 2000s, that was kind of, that was the magic number, right? You start at 500. So I said, okay, let's try 500 milligrams of testosterone. So I bumped it up. I did get bigger, but what I found was that every time I did it, and I would do the PCT, I just couldn't keep the gains like I would hope.
Yeah.
And you know, and I'm a scientific kind of guy, and I did a lot of research, and I'm looking at it, and then after a couple of these cycles, I said to myself, I'm going to stop this until I'm ready to commit to a full-time TRT. So I went back to training naturally for about 12 years.
What age was that?
By about 22, 23.
So on and off the gear for cycling for 2 years,
Mm-hmm.
and then realized that you're going to get shut down,
right? And I'm not, or I'm not bouncing back, right? Like what's happening? I don't bounce back very well because
hypothalamus pituitary. All the guys love all this.
It's just not happening for me. Right. And I said, you know what? The only way to do this, and the way these guys are doing it, is they're cruising.
Blast and cruise.
They're not coming off. And I wasn't at that age. I said, you know what? It would be a poor decision to permanently go on testosterone. So I said, let's revisit this down the road. And so, like I said, trained naturally for about 10 or 12 years. And then around my early 30s, I decided, like, okay, let's pick this up again. And then I did try the first time doing it again. I took a cycle of 400 milligrams a test. And then I said, I'm going to try the PCT thing again. Same results. Came off, didn't bounce back the way I hoped. And then I was like, okay, if I'm going to be serious about this, and I'm getting to that age, and I like the feeling of being on testosterone, it's time to consider just, you know, sort of blast and cruise, but not heavy blasts, but certainly a little extra than the TRT.
What was the testosterone or other agents?
Yeah, so usually my things are test and deca was always kind of my
Cool.
thing with a little bit of oil in there. I love D-ball. I know it's terrible for you, but just a little bit of it for a short time definitely just gives you that little extra bit of power in the gym. It's just a good feeling overall, but it's terrible for your liver. It's just not a healthy thing to do. So
You knew, kind of like a lot of guys know, be very short-lived with it.
and the dosage that people use, even when you hear about these like golden era guys doing it, you hear, oh yeah, they're using say 15 milligrams, 20 milligrams. Nowadays guys say, oh, 50, 60 milligrams of D-ball.
Yeah. 2 months.
And think of the estrogen load.
Yeah.
D-ball is extremely estrogenic.
So you do that now. Steroids have dangers, right?
Absolutely.
Health consequences. How have you in your mind, when you went back on testosterone and blasting and cruising, if you will, to whatever degree you are compared to, everyone's always comparing to each other, which is incredible. There are health consequences, and that. How have you gotten your head around that, your consciousness around that?
Well, so one of my things is that I avoid any kind of steroids that have never gone through human clinical trials. I have never used equipoise, for example. It's just never been approved for human use, and data shows potential
Horses,
kidneys.
dogs, and cats.
Human use was just never on it. So if you look at some of the stuff that is available, you have your testosterone, and your DHT derivatives tend to be your safest choices. They were designed for women with breast cancer, right? The whole purpose was we need to offset this androgen-estrogen ratio, and how can we do it so it's less androgenic, so that we can deploy it in women with a relative degree of safety.
Back in the 50s and 60s.
Back in the 50s,
right?
That's what they had, right? They didn't have SERMs, they didn't have AIs yet. All they really had at that point was use more androgens to offset the ratio.
And monkey with that molecule of DHT and the NOR19, and that's back in the 1950s and 60s. Right now, probably a couple hundred molecules of formulas that were made, but we know we have probably a base of about 50. That bodybuilders even still today use. So that's that. But how did you get your consciousness when you wake up in the morning? So many guys tell me they wake up in the morning and they have the devil and the angel. And the angel usually wakes up with you. They've told me they look in the mirror and the angel's there, and they're tired and they're waking up and they're groggy, and they're weak as far as feeling. What are you doing to yourself? Their weaknesses because they're tired and they're waking up, and the consciousness is kind of raw. And the angel is saying, "Don't do it today. Don't wake up and take the Anadrol, the diet. Don't do your stack today. Right. Take a break now. Time to take a break." And then you kind of wake up, you kind of shrug it off and look at the phone and look at maybe Rich Piana's videos back in the day. I love Rich.
Yeah.
For what he's worth, for being open. And as you wake up and you have your coffee and shrug it off and your pre-workout, the angel goes to sleep and the devil comes up and says, "Time to get big, boy." Let's have to. So how did you do? Guys do. How did you do?
To me, I always look at it as, even as I sit here, we're talking, we're on camera, right? So I don't do things that I think are wrong or morally wrong, right? If I thought something was morally wrong or a terrible choice for me, I simply wouldn't do it. So I look at it as I'm taking a calculated risk. And my calculated risk is that, I keep the dosage to what I feel is the minimum effective dosage. I just don't do anything that is crazy. I do monitor my blood work. And I know that, listen, everyone watching, there is no safe steroid, but there's safer ways to use it, right? And everyone can choose their calculated risk. When I was younger, I did more extreme sports. I take calculated risks. Sometimes I miscalculated and broke bones. Right. But I never did anything that I felt, okay, chances of this killing me probably aren't that good. But in the long term, do you know what's going to happen far down the road? No, but nobody does. You look at some of these
doing
things.
that calculated risk with the adrenaline. Tell us this. So you did one bodybuilding show?
Yeah, that's correct.
Right. How long ago was that?
Back in October, so
Okay, October 2022.
2022.
Okay, and we're going to pop up some pictures here for the B-roll, and tell us the exact PED stack in the cycle.
Yep. So it was 200 milligrams of testosterone, 300 milligrams of primobolan.
Now this is the whole. Now the day, like, tell us the 6 week or 8
So
week.
yeah, so I mean, every cycle that I've ever set up is just you titrate up over time to reduce your exposure to the drugs, right? So if I know that I'm going to be on for 4 weeks, I don't want to be on my max dosage for 4 weeks. I want to start at 150 tests, say, and 150 primo. And maybe I'm going to ride that for 4 weeks until I don't get results from it anymore. And at that point, let's add another 100 milligrams of primobolan, right? I don't want to just redline the car from go. You know what I mean?
Right.
This way, you can take that long-term exposure and bring it down.
Did you learn that? No names mentioned. Did you learn that in the streets yourself, or just?
Yeah, just from just different guys. I mean, I've taken a couple of courses. There's some guys like John Jewett, who I learned a lot from. He's definitely is pushing that kind of model, especially towards coaches, to say, hey, look, there's a better way to do this. There's no absolutely safe way,
Right.
but there is a safer way to do it.
That's why we're presenting you and seeing if what this perspective is and can be. And we have your labs, and we're going to talk about your health in a minute here directly on paper clinically that you allow us to do that. So go on with the PEDs for the show.
Yep. So probably until about, say, by about 8 weeks out, I'm on about 300 primo, 200 test. Now, my goal with test is never use more testosterone than you can handle the estrogen load. Basically, don't use an AI. If you need an AI, that means introduce a different drug that doesn't aromatize. So if you need more anabolics, add in more primobolan, add in more mastron, add in a DHT derivative that is not going to cause this large spike in estrogen, give you all estrogenic side effects, and also, not to mention some of the effects on aldosterone that you're going to see for water retention and blood pressure.
Any proviron in this?
No proviron. I actually, I try to avoid proviron, and actually I even use finasteride to keep my DHT down, which helps protect my hair.
Hair does look good.
And
Good genes, though.
Look, there's a huge genetic component to hair.
Right.
I mean, there's a lot of things you can do to make it, have nice full head of hair for a longer period of time.
Right.
But at the end of the day, the grim reaper of your genes is going to come and slice
Some
up
guys
that
are
hairline.
bald. Getting out of high school, they're bald.
I mean, I think, you're a doctor and you've been around a long time. You probably have noticed that one thing steroids are good at is bringing out genetic factors that are coming eventually and speeding them up, right?
Right.
So when you see a guy who's completely bald on gear at 25, there's a good chance that he was going to be completely bald. He sped that process up. If you have a family history of heart disease and you start blasting gear, guess what? That heart disease might come at 40 instead of 60.
Why I'm here, right? You're accelerating the underlying organic.
Right. So,
condition.
some people are lucky. They simply just are resilient to the drugs. Some people are not so lucky. I have a friend who's an IFBB pro who had to retire early. Why? Because his heart. He had a choice. It was
kidney.
It was throw in the towel and continue to live, or push for one more Olympia.
Right. It's a slippery slope.
Yep.
So you use the DHT derived, the Masteron, Primobolan, right? No proviron with tests, increasing the doses, no AIs. Cutting drugs, diuretics, clambuterol, peptides.
No diuretics, no clambuterol. I'm prone to anxiety, so I have no desire to throw heavy stimulants in there. And then the heaviest thing at the end, I threw in 90 milligrams of Trenase in the last 6
you
weeks.
got some Tren in there.
So, that's something I would only ever use in a contest prep. I would never consider that as an off-season drug. And even then, when you talk about the devil and the angel, that is the only thing where you start to think, you're like, okay, maybe this, and even in a small, 90 milligrams is a small dose. But it weighs in the back of your mind, like.
Did you get short fused, or did it change your
You know,
personality?
it's tough to tell because you're so hungry at that point. You don't know.
I saw you. You looked unbelievable.
I mean, you don't know, is it a trend that's making you agitated, or is it just the fact that you're starving every day?
And it's always that asshole. It's the asshole on steroids, but now it's the asshole on trend. I don't want to see any assholes.
I mean, I've been fortunate that I don't get a lot of outward side effects of steroids.
Yeah.
And by outwards, I mean say aggression or bad acne or massive hair loss.
Good genes again.
good genes. But the other side of it is I don't get the same response that other people can get out of it too. So there's, it's a double-edged sword. Maybe I could have had more side effects, but I'd be bigger. But you know what? I'd rather be a little bit smaller.
Show. So how'd it go in the show?
Not too bad. I mean, I give up a lot of size to the bigger guys, so I still took last in novice. But
It was your first show and you felt great.
But to me, it's just a challenge, right? I'm there to see. I brought the best that I could bring, and I'm fortunate too. I had a great coach that helped guide me to get there, and we just brought the best package that I could bring. It just obviously I just wasn't there to compete with the bigger guys. It just wasn't going to happen.
You stuck with it and you did it?
I did. And listen, and there's a couple of pros that were in the audience that later came up to me and said, "Hey, you were the most conditioned guy in this show. Like, you weren't the biggest guy, but man,
that conditioning thing.
You were conditioned."
Yeah. So, how you feeling today? That was how many months ago?
I was back, about 8 months.
8 months ago. Mm-hmm. And you went, let's talk about the drug, the return to testosterone. So exactly after the show, how did the drug?
Yeah, immediately stop everything and then just go straight back to.
Right, no time off, cause you're on testosterone.
Yeah, so
forever.
but drop all the DHCs, no primo, obviously no trend.
Can I ask you about your sex drive before, during, after the show?
During the show, that period is pretty bad.
Wow.
But that's an effect of the low body fat.
Right.
That's
starvation mode.
You're in starvation mode. Your body is, you're waking up in the middle of the night because your body's saying, hey, if it thinks it's starving. It thinks that if you don't wake up and go find some food, we might die.
Wow.
There's...
Because your body fat was 5%? Legitimate 5%.
I would, about there. I'd say it's about 5%.
It was like paper, just the paper skin.
But yeah, once you get there, your brain's not thinking about sex.
In fact, no clenbuterol, no other of these.
No, but I naturally get lean. Like that's some people's superpower is to get big.
Yeah,
I can get peeled.
Wow. So you're back on testosterone. How much are you on?
160 milligrams a week.
That's your base.
That's my base.
Right. Let's look at your labs, huh? Mm-hmm. If you don't mind.
Sure.
So, and we'll pop this up on the B-roll. So you got 2021, essentially, you came into me, testosterone's elevated, right, 2,000. We see a disparity between the total and the free, because that's what esters do with a sexually binding globulin. Look right down to the bottom there. Yep. And that's, how much were you on there?
About 500, I'd say that's 500 milligrams.
Right, and then you were lowered to a base of a 160 right now, right?
Yeah.
Okay. And interesting piece is that your cholesterol genetically is good. No family history of heart disease, right?
No.
See that? And the calcium score is?
0.
Right. So HDL, but look at that though, suppressing your natural HDL is going to be way over 40. That's that protector. Mm-hmm. And then it's been suppressed from 500 milligrams of androgen. Not to mention, you can imagine when you add more gear on, it's just synergistically suppressing.
Yeah, especially with this blood work, it's not just testosterone. There's also some nandrolone in there and a little bit of D-ball.
But right, so a lot of guys at baseline have very low HDL, and this goes single digits. I've even, on 2 or 3 occasions, saw where it said HDL either 3, less, or even 0. Oof. And I had to sign, the Quest actually made me sign a certified letter that I received that. Because they were like, it was so, they never,
like, guys, is this real?
Is it real? And it's really true. It's super rare. So you have great genetics on that, right? And basically your glucose is always good. You're not pre-diabetic or diabetic. Your kidney function, thank God, is perfect. But your BUN creatinine, you look at the ratios, they're off because of the muscle mass and because of the protein intake and deamination, not to mention the supplements guys will take, and muscle mass with that estimated GFR is normal because your creatinine is normal here, but this is the stuff that for all these men in the world, it's so scary and unknown, because there are so many unknown, and these are moving targets.
And the thing is, there's no fix for kidney disease. Kidneys.
Well, right. That's what I tell guys, and then guys slowly, steadily get into it. It's completely asymptomatic, especially when you're young.
Right.
So, and now liver enzymes are up because what do you want?
And this time there was some D-bol involved.
So that's
in
an oral agent. So
Correct.
right on test and DECA, a lot of the injectable intramuscular, not to mention subcutaneous, you use esters and DHT-derived drugs, all this bro science. It doesn't really affect the transaminases, but it can. Right. It's kind of a threshold of what you. And then some guys have high transaminases and the liver's fine because it's muscle spillover, or maybe there's something else going on with other drugs and statins, and never take statins with oral steroids and Accutane. But all these things, that's why we have the man-to-man show right on this puppy right here, the Anabolic Doc app. So this is a transaminase bump. A1C is great. CBC. So you have such great genetics. I think the Goomba gene, if you don't mind, I call it, where the Mediterranean guys versus the Northern European men have the hereditary hemochromatosis gene. This is all my ABCD stuff. You never have elevated red blood cells, and your iron studies are perfect. That's just good genetics.
But we did have the iron. We've got it under control. My iron can get a little up there.
But
ferritin stays good though.
But imagine what I see with guys with just rolling the dice because of their genes.
Right.
And it's really amazing. So your analysis, negative. You never want to see protein and blood, guys. And you've never had that with the grace of God. And your estrogen's a little bit baby high. And then, so the most recent, this was after the show.
Correct.
Right, yeah, so 2022.
Yes,
so
about 2 months after the show, doing cleaning out.
Right. So same snippet picture of the low HDL. Otherwise, your kidney and liver looked better than the first time. This is why it's dynamic.
Yeah, and that was no oral steroids used.
Red blood cells, not bumped at all. And now look at the ferritin and the iron studies. Look at that, the ferritin. So this is this complex interaction of the androgen-induced erythrocytosis, the deadly shit. Mm-hmm. That's the deadly stuff with the blood clotting and the hypercoagulable states, and bodybuilders die from blood clots, pulmonary embolisms, and heart disease and kidney disease. You guys
recently
have to understand that, guys. So this guy's been lucky. He's young. He's dabbled, and there's the free test. Similar picture. Let's close with this. 2 things. First off, fertility. Mm-hmm. Tell us, and we want to be honest, our testicles, when you're on testosterone, are atrophied. It's kind of weird to tell a man, or it's difficult to tell a young man without PCT or with PCT. It certainly can work to some degree, but we're living with no testicles. I am. Are you?
Yeah, that's to shut down. Years of testosterone use.
We're being honest for young men. We're being honest for young men.
Yep. Yeah,
so, I always say I go from head to toe with hair, puffiness, the acne, gynecomastia, heart, kidney, and a lot of young men can't get their head around the heart and the kidney because they just don't see it. Right. But they see the hair, the acne, they don't want to be puffy to look bad. And then the guy knows every guy's nightmare. They'll spend $10,000 on surgery, even if they don't even have, where's the guy? No, I don't see. No, I have a lump. Okay, so go see the surgeon. Right. They want all these drugs. Okay, so very interesting. But when it comes to, when you tell a young man your balls are going to completely be toasted, the size of raisins, and my wife's not here because she's like, I'm talking about your balls. It's like, got to talk about it, honey, because it will keep you young guys, potentially, and again, hair and balls, but you can have great sex with no balls. It's just, right?
Well, because you're replacing what
it's in your brain. Yeah. Okay, give us some advice, brother, for our audience.
My first bit of advice is, consider, do you need to use steroids at all, right? The first thing is, because there is no safe steroid, there is just safer approaches to take. And think about it, are you in this for the long term? Is this a short term thing that you're picking up right now because it's cool to be jacked?
It will be long term,
right? You know what I mean? Because listen, I have a friend who just recently said, the guy's got no business on steroids, and he wants some advice on, I got to get on a cycle. I want to get huge.
These are all the guys.
And I'm like, just eat better and train. You don't have a long history of training, long history of consistency. But I hate to say not a shortcut, because it's not a shortcut. Well, it's certainly speed up the process, yes, but at what cost is it worth it to you, right? And that's something everyone has to decide. And maybe how you're feeling right at this moment is not how you're going to feel 2 years from now when you're bored of bodybuilding and you're shut down, and now you got to take an injection every 5 days for the rest of your life.
And I just want the young guys that are naughty always to think of that, and to be to hold that perspective if they can. And absolutely, if you're going to be on testosterone, my opinion, try to leave it to as late as you can in life, kind of like you did. And at the end of the day, and then you just have to run your ABCDs to make sure you don't have a health consequence.
But the other side of it is, some people are going to say, okay, but that's the answer to me is I do want to do it. Well, at that point,
respect.
Lowest effective dose. Your first cycle does not need to be 500 milligrams of testosterone.
Right.
Start with a small amount of testosterone. See what you get out of it. If you're not getting anything anymore out of that, maybe you could add a little bit more testosterone. But if the estrogen starts to get high, you pull it back. Don't go on AIs.
And a drug for a drug.
Right.
To
Stop
block a drug
you're
for
chasing
another.
side effects.
The polypharmacy. Yeah.
If you're going to do it, consider DHT derivatives. Are they once again? Are they a safe drug? No, but are they a lot safer than going on Tren? Yeah.
And the problem is, for another video, another time, is the quality of the drugs, and it's just unfortunate that it is illicit. Although I think with the harm reduction strategies, things are really changing. Certainly with the academics and the traditional medical community.
Yeah, and there's definitely a big shift in the underground community in the sense that there's more availability of high quality testing, forcing labs to compete on quality.
Right.
If you know where to go, and obviously that's up to you, right? This is not the topic of this conversation at all, but if this is important to you, search the internet to find the right information and find the right stuff. Don't just take whatever some guy in a gym gives you.
Right.
Make sure that what you're getting, at least somebody's tested it.
And the harm reduction is always going to be right here. Never contacts for steroids here. Never going to allow that here, guys. But this is where the harm reduction is going to be placed for every man in the world on androgens, from just testosterone, regular middle-aged guys on testosterone, that their doctors are great, but you just can't understand all this, all the way through to a range of heavy-duty ped users, from top pros in the world right down to regular guys like us. Thank you so much, Anthony.
Of course.
That was really awesome. Guys, let it roll and give us some great comments, because all the brothers in the world need to reflect on this, and really we need to bring this out. Thank you so much. This is what you get with the Anabolic Doc app. Number 1, a digital history and physical exam. Number 2, weekly Zoom meetings with me. Number 3, discounted commercial labs. Number 4, weekly member-only uncensored videos. Number 5, Anabolic Doc's mailbag. You can't come to the meetings, or you don't want to come to the meetings, you ask a question, I'm going to respond to your question by making a video, put it back up on the app, and you get to see your own question. Lastly, diagnostic and management library that is easily searchable by keywords.